On this week's Case of the Week, I want to show you actually a really nice case, and as always, I folded the name over so you can't see who the doctor is. Although case is so nice, I should probably actually give him some publicity, but I won't mention his name because I don't want to embarrass Dr. Robbins, but it's an awesome case. A couple of things that I like about it, it's a Bruxer case, which is nice. Obviously, I'm a big fan of monolithic restorations. And the VitaMaster 3D shade. Loving it, Dr. Robbins. That's absolutely fantastic that you're using that 3D shades. I'm a big fan of the 3D shades and find that those shade tabs match the natural teeth much better than the Vita Classic shade guides. Let's take a look at the impression. First thing we notice, we've got a plastic impression tray. I'm kind of a fan of metal impression trays, but if you use a stiff enough material, you'll be okay. And as I try to compress this in the area where the prep is, it's pretty stiff. I can probably compress it a little bit, but I don't know that that happened while the patient was biting on it. Usually for there to be compression, you'll see the teeth coming in contact with the tray somewhere, or you'll see the tray coming in contact with the retromolar area, but it looks like it was a clean impression. In fact, if we hold it up to the light, we can see that all the unprepared teeth were just about in contact, save for the mesh that's in the tray. So we know the patient was all the way together, and it doesn't look like there was any impingement on the tray itself by the teeth or the soft tissue. So we're going to assume that patient came together, and so in the end, really probably nothing wrong with that plastic tray. I just like the stiffer metal trays, probably personal preference. Let's take a look at the actual impression of the prep itself, and it's gorgeous. I mean, it just does not get any better than that. We can clearly see the margin defined 360 degrees around the tooth itself. We can see a tag of material, at least a ½ millimeter of material beyond the margin as well, and so there's going to be no doubt in the technician's mind where this margin ends and how to fashion the emergence profile of this restoration, because this little tag of material here is in fact an impression of the root structure of the tooth. So fantastic job with the impression. Let's take a look at the model, and you would expect it to look pretty darn nice, and it does in fact look pretty darn nice. In fact, I grabbed this when I saw it before it's even been dye trimmed, but it already looks like it's been dye trimmed because it's such a clean impression. So really it's just a matter of going in and taking away some of this stone that you see around here to expose the margin. So you can see how easy that's going to be to dye trim. In fact, if you had a dental technician on here on their very first day, this would be the case you would want to start with, because the better the impression we take, the more basic it is for them to be able to trim the dye, and the easier it is. You don't need advanced dye trimming skills until dentists start to send you less than ideal impressions. It's just a great looking prep too. We got 5 millimeters of height on the preparation, so this Bruxer crown can be cemented with a traditional crown and bridge cement. My choice would be the Ceramer cement from Doxa, because the dental advisor has shown that it actually chemically bonds to the Bruxer material. If we look at the bite, when we have the patient bite together or have the model bite together, we can see we've got at least 2 millimeters of occlusal reduction there, and that's actually more than we need for Bruxer, but that's going to give us a Bruxer crown that's going to last for decades instead of years because of that reduction. So we've got a nice clean margin too. In fact, this is really kind of a universal prep. This will work for a PFM, this would work for a lava crown, this will work for an Emax crown, and this will certainly work for a Bruxer crown as well. In fact, since this is a Bruxer crown, if you wanted to be more conservative, Dr. Robbins could have prepped the feather edge margin, or could have just prepped the knife edge, or could have prepped the bevel. But this universal prep is fantastic. This is exactly what I like to show dentists as the ideal preparation. I use the reverse prep technique to get to this point. I don't know exactly how Dr. Robbins got to this point, but it doesn't matter, because it's absolutely fantastic and a great example of the type of dentistry we should all be doing.